Good afternoon, everyone. My name is Isabel Proaño. I am Director of Policy and Communications at the European Federation of Allergy and Airways Diseases Patients Associations, EFA, and I will be moderating this event for you today, which is organized in the framework of the European Parliament Interest Group on Allergy and Asthma. Over its 7 years of existence, the Interest Group on Allergy and Asthma has served members of the European Parliament to promote allergy and asthma health in Europe. We are delighted to count on 15 MEPs today who currently integrate the Interest Group and who have made it all well-recognized forum of health prevention and care expertise within the EU institutions. This event will last 1 hour and 15 minutes, ending at 2:15. We will have a few introductions from a member of the European Parliament, Tilly Metz, EFA President Carla Jones, and EFA Youth Ambassador Freyja. Then we will go to our panel, where we will discuss with prominent speakers ideas to address unmet needs in allergy and asthma care. The panel will be followed by a question and answer sessions where you will have the opportunity to interact through the Q&A function that you see on your screen. And afterwards, a member of the European Parliament, Juozas Olekas, will also lead us to the end of the event. In case of a technical problem, please use the chat, write to hosts and panelists. My colleague Jeffrey will guide you through. And now let's move to our first speaker, Tilly Metz, who is a member of the Luxembourgish Green Party and has been serving as an MEP since June 2018. Is a member of the important Committee on the Environment, Public Health and Food Safety, ENVI, and a substitute member of the Special Committee on Beating Cancer, Berg. She's very committed to health issues, and she's also the co-chair of this interest group on allergy and asthma. Mrs. Metz, the floor is yours.
Thank you very much, Isabel, for this kind introduction, and a warm welcome to the event attendants. And I'm still wishing you also a happy and most of all healthy new year. As an introduction, let me say that allergy and asthma are among the most prevalent chronic conditions in Europe and the most prevalent in Europe's children. So around 100 million Europeans suffer from allergic rhinitis, while almost 1 in 10 children in the EU live with asthma. And I know what I'm speaking about because I really had asthma also when I was a child. So as both are chronic conditions, these people, these children, will most likely have to live with these diseases for their lifetime. While the diseases surely have significant effects on patients' health, the real burden of allergy and asthma is very diverse and touches on many aspects of their life. It's social, it's emotional, it's economic. Worryingly, allergy and asthma cases are increasing, mainly due to environmental factors, such as air pollution, climate change, and the loss of biodiversity that continue largely unaddressed. So this situation is a constant reminder to all of us, the decision makers, to live up to the challenge, among others by encouraging an effective and really patient-centered delivery of care across Europe. Unfortunately, today there are certain barriers and challenges that represent persistent unmet needs. These include disease, mis- or underdiagnosis, which is very common in allergy and asthma. Lack also of access to innovative and high-quality treatment at an early age. The challenge also to develop solutions for uncommon allergies and pediatric asthma, and limited patient access to medical trials. In nowadays, discussions such as this are even more pressing. A significant disruption in the delivery of care due to COVID has left many patients astray. On the upside, we live in a moment where health has finally a central stage in the EU discussions. There is a unique window of opportunity that we should embrace now. Many initiatives are currently at work on the legislative side, including the new EU Pharmaceutical Strategy, the ongoing revision of legislation to improve medicines for children and rare diseases, and the general pharmaceuticals legislation, which will be capital to define the way patients access treatment. And also the proposal to regulate a future European health data space. And I'm looking forward personally also to work on these files for the Greens. As policymakers working on health, our job is to listen to patients facing challenges and to respond to their needs. The European Parliament Interest Group on Allergy and Asthma that I co-chair works to include allergy and asthma needs across policies to improve prevention and to enable access to high-quality healthcare for all, including support to research and innovation. To achieve this, we of course need to build collaborations and work together, making sure that also the voice of young patients is loud and clear. Therefore, I'm particularly glad to see that the European Allergy and Asthma Youth Parliament is ready to take a central role and fully second the EU policy recommendation, such as how technological tools can be an asset for young patients to make their disease daily. I am very honored to co-host this event and engage with you to better understand the main aspect of this complex policy challenge. I really look forward to hearing the perspectives of patients, healthcare professionals, and the pharmaceutical industry also on how we can address patients' unmet needs in allergy and asthma care in the most effective and health-protecting way. So I wish you all, and I will stay here, of course, I wish you all a very fruitful discussion. And I will give the floor back to Isabel to introduce Carla Jones and Freyja anchors. Thank you very much.
Thank you very much, Mrs. Metz, for your inspiring words that set the tone to this event. May I now give the floor to EFA President, Mrs. Carla Jones, who is also the CEO of EFA member Allergy UK. Carla, the floor is yours.
Thank you, Isabel. Firstly, I'd like to say a Happy New Year to everyone. I hope you're all safe and healthy and your loved ones are too. It's a great pleasure to welcome you to this event of the European Parliament Interest Group on Allergy and Asthma. And I thank you for your interest and for joining us in this discussion, an important discussion. I'd especially like to thank the members of the European Parliament, Ms. Tilly Metz and Juozas Olekas, for kindly hosting this event and for their work as members of the European Parliament Interest Group on Allergy and Asthma. Their support and work on this is vital and much appreciated. I also bring to you warm wishes for allergy and asthma health in Europe from Mrs. Sirpa Petkanainen, who cannot join us today due to a loss in her family, and our heart goes out to Sirpa at this time. Today, we will be discussing one of the most ambitious initiatives in the EU today, the European Health Union. This transforming project contains a new European Pharmaceutical Strategy set to address some of the biggest challenges linked to healthcare in Europe. We at EFA are allergy, asthma, and chronic obstructive pulmonary disease patients, and also carers for those patients. And we're united in informing and instigating change in policies that will benefit patients and all people living with these diseases. The future European Health Union and the upcoming pharmaceutical legislation is paramount for us. And that's because despite this pandemic resulting in new drugs and medical research discoveries, as well as the transition towards digital health, we as allergy and asthma patients and carers get a sense of déjà vu about these developments and that they won't fully support or prevent allergy and asthma and deliver to patients the needs to help them live the best quality of life that they can. So I'm very pleased that patient unmet needs will be discussed today because the European Pharmaceutical Strategy is the opportunity to change our lives for decades to come. But what are the gaps our community experiences today? I'd like to mention 3. The first and most striking unmet need among patients is limited access to medicines. Access to existing treatments, including new medicines for patients with allergy and asthma, is not equally spread across Europe. There are many complex systems that could explain this, such as national regulatory preferences, pricing, shortages, education amongst healthcare professionals, even ignorance about the treatment portfolio and structural barriers in healthcare. But all that might sound irrelevant and secondary for many patients in Europe who are not getting the treatment they need, especially in the cases of treatment for certain types of allergy or asthma. In the case of severe atopic eczema, patients report having to pay about 927 euros out of their own pocket to manage their conditions per year. And this is on top of other healthcare costs that they have. So we need future policies to fix this inequality. The second gap is related to patients' adherence and the huge work that remains to be done to support patients in managing their disease, because we recognise that there are responsibilities of patients as well. Let me give you an example. While asthma is one of the most common diseases in Europe, 1 in 4 asthma patients visit on average once a year the emergency admissions at hospitals. A survey that EFA conducted shows that one reason for this alarming high number is that about half of the patients treat the symptoms rather than treat the cause of the disease. This means that patients opt for emergency reviver medication to avoid asthma attack, rather than frequent treatments to maintain their lung function. Again, there are many explanations behind this striking data, but the question that EFA asks, do patients fundamentally understand what is the medication and why they take it? What's it for? Has someone explained it clearly enough to them? Are patients taught good inhaler technique? Do patients have a self-management plan agreed with their doctor? Because currently 1 out of 3 asthma patients tell us that they don't have one. Do patients have concerns about their treatments, and are these concerns addressed? And can patients afford their most basic medication if lots of them are funding this themselves? Understanding patient adherence can help define medical unmet needs, but should also be at the core centre of strong and meaningful participation of patients in the development of treatments and decisions affecting their care. Lastly, an unmet need is the apparent limited interest towards allergy needs. Allergies have impacted my family for my entire life. And as a result, I have witnessed the persistent under-prioritisation of allergy in policies, plans and budgets. There are many treatment gaps for allergy. The disease is complex, as we know. And we will hear from Professor Jürgen in a moment about this. But the EU should have a clear ambition to serve all patients. Despite complexity and impact on quality of life, allergies are mostly managed with over-the-counter medicines, or for food allergy, it's avoidance of certain foods and being prepared for anaphylaxis. So being prepared to have an anaphylactic reaction. I have several members of my own family that have experienced numerous anaphylactic reactions, and the impact for them and for us as family members is horrific. We hope future EU legislation and support for research will accelerate the development of personalised medicine to further extend our knowledge into the causes of allergy and airways diseases, while moving towards more targeted treatments and care to lead to a better quality of life. So, ladies and gentlemen, colleagues, partners, stakeholders, a pharmaceutical strategy is not only about medicines, it's about the life for patients. It's therefore high time the EU channels efforts to improve prevention of and care for people living with allergies and respiratory diseases through research and breaking barriers to access medicines. I thank you very much for your attention today. Welcome all the speakers, and hand over now to Freyja Anchors to provide our young people's perspective. Thank you.
Thank you very much, Carla. It is an honor to speak to you all today and to bring the young patient perspective on such crucial issues for chronic patients that can impact our access to medicines and quality of life throughout our childhood and young adult life. As a young person myself, living with asthma and allergies, I have to take each day at a time. Navigating growing up with chronic illnesses has led to myself and many young people like me to miss out on life experiences that we shouldn't have to, such as hanging out with friends or being able to travel without worrying about accessing medicine or emergency treatment. I want to be able to choose what I do on my free time, where I travel, which school I go to, and what I work with based on my interests and not be limited by my illnesses. The European Allergy and Asthma Youth Parliament is a forum of young patients and healthcare advisors from across Europe who want to improve allergy and asthma prevention and care. And as young patients, our resources to cope with our diseases are rather different compared to adult patients, often to our disadvantage. When adult medicine is approved first, it can delay or even disincentivize further research into the needs of other population groups. As a result, pediatric needs come second. And young people are our own person. We are not a subcategory. Our unique needs as young patients can range from needing different accurate dosages to adults to having access to accurate information ourselves and not through our parents or carers. We might also need extra flexibility in a time of our lives when everything is constantly changing. We welcome initiatives to research and create new treatment and care pathways that give priority to young patients. With the EU support, the results can bring great benefits for our quality of life and lessen the burden of disease. But we do not want to be a silent benefactor. Young patients are key partners in medical research to help create a personalized approach to our treatment and care so that the needs of young patients, us, are met. Those of us living with severe asthma are some of the most at-risk people from developing serious symptoms from COVID and suffering from these consequences of long COVID, which has meant great challenges these last years. But during the pandemic, we have also seen amazing opportunities emerge, especially in digital solutions and not least in healthcare. Digital health can help us manage our diseases through treatment plans, through monitoring symptoms, and help us avoid triggers as well. And digital tools can help young patients lead full lives by granting us the flexibility that should come with our young age. At this moment, where we have all relied on technology for everything from socializing to work to healthcare, we must explore the full potential of technology to deliver patient-centered tools addressing treatments, self-management, and leading to patient education. New research and innovation in medicine should go hand in hand with developing digital solutions for managing healthcare so that young patients like me are not limited. And by meeting the needs of different patients, healthcare in the EU can reduce inequalities and improve accessibility. So thank you for listening to me and the European Allergy and Asthma Youth Parliament. I hope you enjoyed today's discussions and continue to follow the Youth Parliament's work.
Thank you very much, Freyja. Your insights in healthcare are indeed rather unique. I would like to remind that you are a member of the European Allergy on Asthma and Allergy Youth Parliament, and that you come from one of EFA's members organization, the Swedish Allergy and Asthma Association. So thank you for being with us today. I would like to move us all now to the panel discussion, but before we kick off, I would like to invite you to interact with us, addressing your questions to the speaker of your choice through the question and answer function. Please include your name and organization and who you would like to address the question to. I will relay them to the speakers who will answer and discuss them further. You can also choose to ask the question by yourself by raising your virtual hand up that we will see and monitor. You have seen in the chat, you can also join us on Twitter through the hashtag EP Allergy and Asthma. And now let's move to our panelists. We've heard from legislators and patients different expectations to address unmet needs in allergy and asthma care. But how can all this happen on the ground? So welcome to our distinguished speakers today. I will briefly introduce you before the questions. We have first Professor Jürgen Schwarzi. Thanks for joining us today. I hope I pronounce your name correctly. You are a pediatrician specialized in allergy and respiratory medicine and an internationally recognized expert in immune mechanisms and associated airways allergy. You are the Secretary General to the European Academy of Allergy and Clinical Immunology, EACI, who was co-organizing today's event. Welcome. Mr. Schwartz, as Carla mentioned in her opening, allergies and asthma are not single diseases. They are complex to treat and there are still many gaps to get optimal care. As a prominent medical professional, what are the most pressing needs in allergy and asthma care in Europe for you today?
Thank you for the introduction. I think I'd like to address that under two headings. I think there's two big areas where we have major needs, and there's some repetition what's already been said. So one is we need easy access, or patients need easy access to the most appropriate, safe and effective medicines and other management options for allergies and asthma across Europe. And the second complex I'd like to briefly talk to is we really need better prevention of allergy and asthma, and we need disease-modifying treatments, so treatments that will have longer-term beneficial effects even if the treatment itself has been stopped. And that requires increased research efforts and the appropriate funding for that. So to go back to the first point regarding access to appropriate, safe and effective medicines, one issue certainly is reimbursement. I think reimbursement policies across Europe need to be aligned, that people throughout the continent are able to access the right treatments and the right medicines. One sub-point is that the allergen product regulations, for example, need to be harmonized. There is currently a big disparity in what kind of allergen immunotherapy products can be accessed by patients in different parts of Europe. Apart from specialist medicines, I think it's also important that there is universal access to good quality non-specialist medicines for asthma and allergies. And this is probably in most countries through primary care, which requires training of clinicians, that they know how to diagnose allergies properly and what the correct first-line treatments are. A further point, and I guess really also a huge challenge, but also an opportunity, is the advent of precision medicine. So precision medicine is the idea that you treat specific subgroups of patients with the appropriate drugs or the appropriate intervention for that subgroup, and that you go away from the traditional approach where you just say there's a one drug that you give to everybody with the same condition, for example, asthma. And we already have position papers and guidelines that make very valuable suggestions as how to do that. But this requires much more work to actually being taken up in health system. It requires a mental shift, really. People, I think, through multidisciplinary partnerships, open collaboration, knowledge exchange, and really rethinking healthcare, need to make use of the knowledge that we now have that identifies patient subgroups for the appropriate targeted treatments. And another big opportunity, which is currently still underdeveloped, is digitalization. For example, Carla mentioned adherence earlier on. So digitalization apps can be very helpful in helping people who live with asthma and allergies to take the right treatments or undergo the right interventions when they're required. Digitalization can really help with finding biomarkers. Artificial intelligence in the future will certainly be able to help with more specific diagnosis of allergic conditions. To move to the second major topic, so I said we really need much better prevention of allergy and asthma. We need disease-modifying treatments. And I really think that with the COVID-19 pandemic, which has obviously been a challenge, there have been real opportunities as well. People have, as Ms. Metz has said earlier, first of all, health has really come up on the agenda. Secondly, there's a clear recognition that such pathogens like SARS-CoV-2 are linked to chronic diseases, non-communicable diseases, and asthma and allergy are two of such non-communicable diseases. So I think this will hopefully open up the possibility for more research in our field of interest. The pandemic has also really highlighted the importance of disseminating knowledge and collaborating in research very openly and across borders and across different disciplines. And again, I think this will be, if this momentum can be maintained, this will be very helpful in the future. So research approaches that are needed are, for example, research that looks at real-world evidence, for example, using registries of patients. Another big area that should be developed further is what people currently call big data. So basically information from patients, from citizens about their conditions. And in order to do that, there needs to be public funding from the EU for EU-wide patient and citizens organizations to help enable their members to really contribute to research in a very meaningful way. And the other area, apart from traditional approaches to drug development, that I think will be really important is what people currently call the One Health approach. So this is the recognition that diseases like asthma and allergies are influenced greatly by factors such as global warming, climate change, pollution. And if you want to, I can sort of explain that in more detail later if there's interest. So that's really what I wanted to say. So I think there are big needs, but I think there are also real opportunities currently. Thank you very much.
Thank you very much, Professor, for this very synthetic, although complex thing you have just informed us and presented to us. I take that there is a lot of research and work to be done, and a lot of that comes from the pharmaceutical sector. So I would like to hear the views of our second panelist, Mrs. Tina Toby, who is Director Market Access and Orphan Drug Policy at the European Federation of Pharmaceutical Industries and Associations, EFPIA. Thank you for being with us today. Tina, many patients are looking towards the researchers in academia and the pharmaceutical sector to find the drug discovery that will really change their lives. So what are the current barriers and bottlenecks to this medicine development in sensitive areas, like, for example, in our disease areas at EFA, low prevalent allergies and pediatric asthma?
So thank you very much for inviting FBR being part of this important discussion. I hope you can hear me properly. So the question you've raised, how is unmet medical need influencing companies' decisions and how it's influencing portfolios? So maybe we can step back a little bit, just briefly, and saying how kind of investments decisions are made by the pharmaceutical industry. And we can roughly summarize this into three buckets, which is surely the scientific and clinical factors, we need to take into consideration as well as the commercial and the policy framework the industry is operating in. And if we look at these factors, while all of them inform investment decision, they are not necessarily important equally along the value chain. So meaning unmet medical need plays a role throughout the whole value chain for the pharmaceutical industry, because it's a cornerstone for pharmaceutical innovations. And therefore it's very critical to have a common understanding of the concept of what does unmet medical need means. But in our understanding, this is really clearly any kind of medical condition which is not adequately prevented, treated, or diagnosed by an authorized intervention. Now, coming, for example, to the preclinical stage, it's often, of course, the question then around the pathophysiology. Do we have understanding of this? If there's a promising target really to address, and of course, there's a question of unmet medical need. And when it comes to the unmet medical need and the understanding of the disease, which we are discussing today, asthma care and allergy care, is really bringing in patients and physicians early on to get their understanding, preferences, and need, of course, to learn more about the disease, but to seek a deeper understanding, but also to learn about the preferences. And this is taking into account into any investment decision. And I'm just saying this and alluding this a bit more prominently because especially in the preclinical stage, the most important decision driver is or are the scientific and clinical factors for industry. And if it comes, and it has already been mentioned, to severe asthma, for example, the challenge is a scientific one, because the knowledge around the pathophysiology is quite poor, where we need to learn more, where we need to collaborate more in a way, public, privately, working together to learn more. What does it really mean to foster research? So therefore, it may be one explicit example where there is a concrete bottleneck for especially severe asthma, while really thinking around the unmet medical need and how it is really incorporated into the decision makers really abroad along the value chain.
Thank you, Tina. Many interesting points. I believe there are also challenges in access, and that we have the pleasure to have with us today Dr. Stanimir Hazardjev, Secretary General at the Patients Access Partnership and Chairperson of the Bulgarian National Patients Organization. Welcome, Stanimir.
Hello.
Patients have many expectations with the ongoing changes in the EU pharmaceutical legislation that Mrs. Metz at the beginning sorted out and summarized to us. So what do you think should be the most important criteria defining these unmet needs?
Well, unmet needs is could be narrowly defined to the needs of a person from biological, medical point of view or treatment point of view, as we heard. But I think that a human being, a patient, is not only to be a subject of the treatment process or the knowledge of the doctor, where you receive the current treatment or what we have available at the moment, and according to the advancement of medicine. At the end, patients spend most of their time back in their homes, with their families, at their job places. And actually their needs, beside getting the treatment, are much wider, and they include different needs in terms of social support, for example, support with the family and the family members going through the disease. If you want, it was already mentioned, the compliance issues that patients have. Most of them could be resolved if proper information and proper tools are available for patients at their homes. When we talk about collecting data, which is invaluable and has great potential, as the previous speakers said, and we need to encourage patients to share their data, also their so-called soft data from their lifestyles, from the way of living, the food that they eat every day, the physical activities. All this is really invaluable data, but how we make sure that the patients can share this data in a structured way to be usable, and really this data to serve back to them once it's analyzed and once we capture the knowledge that we want out of this lifestyle data, soft data, or even the data from the daily life of patients. So unmet patient needs go beyond the need of a treatment, the medical service that the patient needs. It's even more when we talk about the disease. We have to have this holistic approach and not only focus on the disease itself when it is there and once it's diagnosed, but we have to assure that the patients or people live healthy lives and are healthier as long as possible. And if they get any chronic disease, we capture it early in advance so we can manage the disease in the right way. So here there is huge unmet patient need. And this is in many diseases. We constantly talk about early diagnosis, about screening programs, about consistencies in the ways governments provide different prevention policies, information, etc. During the COVID, we saw the huge disparities and the differences in the countries, not only in terms of supplying medicines or purchasing power of the countries, pricing differences as well from country to country, sometimes some differences which are really difficult to explain, like poorer countries not being able to have this purchasing power and to assure big quantities of medicines, couldn't achieve such good prices as some of the more wealthier countries. So all this needs to be addressed properly in the pharmaceutical strategy of Europe. All this has to make sure that regardless where a patient lives, the governments and the European Union would assure that these patients would get timely diagnosis with exactly the same quality standards which should be applied to every single step that the patient should take throughout the system, going to the treatment that the patients around Europe need to have, and their doctors need to have this arsenal of all treatments they might need in order to help the patient, but also to make sure that services and additional services around the concrete disease are in place and also available for patients. I think there is huge potential in the digital technologies, and as it was already mentioned, we have to look into the opportunities as well. And I see that in all these aspects I mentioned, digitalization, AI, personal assistance, these are new things to come, and I'm sure they will have much better and bigger role in the future, including in collecting data from patients, sharing it with their doctor, and why not analyzing and even giving some advices to the patients, or early diagnosing some of those patients, or screening even to whole families, entire families, because the artificial intelligence and the artificial assistant can stay in every home of every patient and could be available 24 hours daily, which is not the case with our doctors and the healthcare providers. This has great potential in the future, I think, to address the access issues.
Thank you very much, Stanimir. I would like to come back to Jürgen. How does all this resonate with you? We have heard from you at the beginning the unmet needs from more a practical side, clinician side. How do you think that you can help in responding to the needs that you see in your daily practice and the issues raised by Stanimir? This might be the opportunity of the decade.
Yeah, I mean, if you say in daily clinical practice, what we can obviously do, and I think many of my colleagues and I try to do, is to actually have a holistic approach to patients, to listen not just only narrowly to what their medical needs are at that time, but how they live with their allergies and or their asthma, and understand what the issues are. And at least in some way, we can probably help advise and enable people to cope with their medical issue better, and through that also have the kind of lives they want to lead. I mean, the example really that I could give, being a pediatrician or a pediatric allergist, one of the most incapacitating things around allergies is fear. And fear is often way above the actual risks. So very often, one of the central things I do in consultations is to make clear what my impression of the risks are. And usually they are much, much lower than the impression that parents have, who have read about the few catastrophic cases of people who have died with allergies. And very often their children or they themselves are not in that risk category. So I think it's important for clinicians to not just focus narrowly on the actual condition, but take into account the wider aspects and how that affects their lives.
Well, thank you very much. We know you do that with your patients. I would like to ask Mrs. Taube if this more holistic approach of patient participation into the development of clinical trials, for example, is something that the pharmaceutical industry is also looking at, and how that could be reviewed to get more patient participation within the revision of the general pharmaceuticals legislation and all the different policies that were being reviewed because of this new European pharmaceutical strategy.
Yeah, thank you. So I think we all agree that this pharmaceutical strategy can be a huge opportunity to really create the future-proven regulatory framework we need really to address the unmet medical needs for patients within the European Union. Now, when it comes to the how industry is working together with patients, getting their experience, listening to their experience, and also their with the disease and their daily experience with the disease, as well as their knowledge about the disease. It's really that for industry, there is no longer a why we should engage with patient or involve them. It's clearly seen that there are the more consistent and meaningful you engage with patient along the whole life cycle, meaning from very early discovery of a potential target until the very last end, until to the reimbursement, is enabling us to take better decisions every step of the R&D process, as well as to ultimately come to better patient outcomes, because they are more focused on the need and preferences, what they really need. So there is no longer a why, it's really throughout the whole life cycle, which is important for us, and we are really dedicated to this. And I think the how is really there is always room for improvement where we can agree on, and there are great initiatives at the European level in terms of like IMI paradigm and all other great initiatives. I'm not listing here all of them, where we try, because FP is supporting, for example, IMI paradigm, where we try to work on tools and instruments really also to enable patients and to educate patients to participate in any kind of research priority setting, in trial design, in discussing endpoints which are patient relevant, because all of this is really desirable and invaluable for all of us. But the point is also the patient have to be enabled really to do so, because these are complex processes, and everyone who've read a clinical study report could be quite overwhelmed the first time without any knowledge about what's behind it. So therefore, it's very important to encourage patients. I just see one comment in the chat that only English-speaking patients are involved. Indeed, it's a challenge. The language barrier is a challenge for us, and we definitely need also to work on this to really enable also other languages or patients who speak other languages than English really to participate in this. But this is crucially, and therefore moving forward and fostering these private-public partnerships where we can educate and deliver really on these kind of necessities to make it work are extremely important from our perspective.
Thank you, Tina, and also for addressing some of the comments, questions we are already receiving in Zoom. So we see there is, on the one side, more participation from patients on development of the treatments, but on the other side, there are still hiccups on how those treatments are being accessed. And I would like to ask to Stanimir, you know, in terms of the legislation that is coming, what do you think that this can really fix? What would you like to see as a patient advocate that this new revision is leading to? What is the change on the ground that you want?
I think there are several steps that we need to take as society that lives in our common home called Europe. And because, as we saw during COVID, diseases don't have any borders. They simply spread all around, and one affected country could be an issue for the entire region. So and this has been the case even before COVID, but it has never been so prominent and so obvious to the politicians. We still have countries where delays for medicines are huge, 2 and more years between the registration and the marketing authorization given by EMA, the European Medicines Agency, and when the reimbursement decisions are taken in many countries. It's not only 1 or 2, like I live in Bulgaria, which is traditionally thought to be and meant to be the most problematic country, but it's not only Bulgaria, it's so many other countries, especially from the so-called new EU member states, but not only. We see more and more countries from the old EU member states with such challenges into the decisions and delaying in the processes. The excuse usually goes back to different procedures, HTA processes, and a variety of methodologies that differ from region to region, from country to country, from hospital to hospital sometimes. Still, for me, it doesn't make any common sense when you have one united institution responsible and saying something on a new medicine on behalf of the entire scientific community and on behalf of all Europe, and registering this medicine and authorizing this medicine to be distributed around Europe, still countries to take their own reimbursement decisions, not based on real medical needs, but based on so many other criteria, and with one of the major criteria, which is price of medicine. So one thing that could be addressed properly is to tighten and to bind this timing between the marketing authorization and the reimbursement decisions. I would go even further on that, and patients around Europe, I'm sure, are going to be happy if this happens. The reimbursement decision itself doesn't help to have access to the medicine or to the treatment. But what really could change the situation in many of the countries, if we have kind of common agreement and approach on European level on the treatment guidelines, for example. The treatment guidelines are something that we have it on European level, but unfortunately, for various reasons, it's not always taken and implemented into the member states and into the hospitals. The reasons are really different, but the major challenges are that in many of those countries, the products are not available, or the services are organized in completely different way, that the guidelines hardly could be taken and replicated in each and every country. But Europe has a place here in this process, and I think this is something else that the pharmaceutical strategy could address. What are the principles and how treatment guidelines are implemented in the countries once the medicine is available, once the data from clinical trials is there? I doubt whether the genetics of Bulgarians and the Germans is so different that in Germany they would use one set of medicines based on one set of rules, and in Bulgaria they are going to use for exactly the same disease. There's the same patients population, completely different approaches and sets. So these kind of issues need to be addressed, and even these two things, which are quite big in a way, but even if we start talking and trying to address them now, this could change dramatically the situation for many of the member states. I'm not touching the pricing issue because this is a very, very complex, again, issue, but I would say medicines are not as good as any other good. They are not tomatoes, they are not potatoes, so we can imply the principles of the free market that are so well guarded within Europe. Medicines are life-saving products, and therefore member states need to find a way to have a bit more fair and solidar system when providing medicines, especially the life-saving medicines, to citizens. We saw during the COVID that this is possible when there is political will with the vaccines and the entire efforts that governments did. Still, we saw many countries where vaccines were freely available, like in Bulgaria. We have so many vaccines, but we are still about 30% coverage of the population only, which shows that having free medicines is simply not enough. If you don't have proper system, if you don't have trained staff and doctors, if you don't have proper organization, if you don't have the guidance that I'm talking so much, and the guidelines and the algorithms in place, then this is the result. We have so many free doses of vaccines right now, but we couldn't we failed in communicating properly with the people and organizing it in the best possible way so we can reach those who need it.
Thank you, Stanimir, and thank you all the three of you for sharing your very expert insights from different perspectives. Now I would like to engage with the audience. You have been already asking questions in the chat, also in the question and answer. But before doing that, I would like to welcome to the Q&A the two MEPs that are hosting this event today. Hello back, Mrs. Tilly Metz, and welcome to Mr. Juozas Olekas. Let me just introduce you. You are a Lithuanian surgeon and politician, a former Minister of National Defense from 26 to 28. And in 1990 and from 23 to 24, you also served as Health Minister. Since 2019, you are a member of the European Parliament within the Socialist and Democrats groups, and you are also Vice Chair of this interest group on allergy and asthma, who is hosting this event today. Before proceeding to the audience, Mr. Olekas, do you have any question or reaction to what has been said so far?
Thank you, Isabel, for your kind words. And dear colleagues, it is a pleasure for me to be part of today's event and to hear such a diverse range of ideas as well as highlighted concern, which affirms that asthma and allergy remain a critical area of health policy that is still not well addressed. Asthma and allergy must clearly be addressed at the European level, as this is the only credible solution to approach the issue in innovative, scientific, and holistic manner. In the long history of health policy evolution, we have seen member states attempt, which sadly often failed, to address this issue on their own. First and foremost, I want to emphasize my firm opinion that preventive certain health problems and diseases should be our top concern. pediatric asthma, for example, which is frequently induced by triggers in the child's environment, require a much more holistic approach for being addressed. Helping our children avoid being exposed to places where other allergies triggers can lead to asthma development should be addressed in a more coordinated manner. In the current state of affairs, there is frequently a lack of information. I think it was mentioned many times today, or assistance available to safeguard the environments in which children grow, particularly if they are already knowledgeable of the certain allergies. Additionally, overdiagnosis of disease subtypes, the lack of adaptation of adult drugs for children who require different dosage, limited access for children to clinical trials, and limited knowledge given to young patients are all common barriers to accessing medicine for young patients with allergy and asthma. Second, and equally crucial, is the creation of treatments that benefit everyone. It was mentioned the guidelines of treatment, the accessibility of medicines. We shall focus on the unmet needs of allergy and asthma patients. For example, the development of tolerate medicines for involved accurate side effect calculations, drug allergen reduction, and early risk assessment communication to patients. Furthermore, research and innovation are essential of all of this. I'm really pleased to hear the conversation at today's session, since this debate on the one hand raises awareness of unmet requirements, but also it is also necessary for us, policymakers, to hear representatives of various interests, policy recommendation, and proposed methods to address the recognized problems. And I think this is my impression for this part of our discussion. And thank you very much. And I will follow the question and discussion part of this our session. Thank you very much.
Thank you very much, Mr. Olekas, for all the points that are very important and that summarize very well what was said. I invite the audience to come up with the questions that you would like to ask. I would like to relay already one that I have here from Mr. Nikos Papadopoulos from the University of Athens. He has a comment that could be turned into a question. He says, regulators and payers do not consider quality of life as an important outcome, particularly when it comes to medical registration. This needs to be amended in his view and could be amended with political will. What would we need for that? Can I ask Mrs. Tilly Metz?
Thank you very much. That is a very good remark, a very good question indeed. I was now working also on an enforced role of the EMA, and there we try at every legislation on health, we are working to really more involve the patients in the whole procedure indeed. And it was already said today that we need more real life data and also about more information about the quality of life, about the real added value of medication. So it's not only giving out the medication, and then we need to have a clear monitoring also and data on what is really the added value for the person. And so it's completely right. We have to shift. And it was said today, I'm very happy, it was said by Professor Jürgen Schwarzer. He really spoke about the mental shift, rethinking healthcare. And also it was said that we need more personalized and targeted medicine. So that all goes, also the idea that was mentioned by Stanimir Hazardiev, sorry if I mispronounce it, really this very important idea of a holistic approach. So to support also the family, etc. All that and of course being part of the Green Party to guarantee a healthy environment. So all that is part of also in supporting, enhancing a quality of life, and that has to be considered throughout the different legislation. So it has to really also be a guideline when we tackle now the different legislation, to always think of this, that is what we are fighting for, is to improve quality of life of the patient. So really this holistic but patient-centered approach that we need to have through all the legislation. So it's a very good point, and I thank you for the question.
Thank you, Mrs. Metz. We also have a comment from one patient advocate from France, Lilia Hentet, from the French Association for Respiratory Patients, who says that the situation with coronavirus to date has shown the importance to provide sufficient medical care to prevent and to treat diseases, and that sometimes it is the limited resources of the healthcare system, the limited number of healthcare professionals, and not enough number of hospitals for this in the setting of a pandemic that has put patients really to strain. So I would like to ask Mr. Jürgen, how can we, within the European Union policies, improve this situation? Is the European Health Union the good initiative to start going ahead with that, forward with that?
I hope so. I hope that it will be. I guess this is probably just one aspect, but I think one really important aspect in all of that is proper training of healthcare professionals and proper education. So from our interest area, asthma and allergy, it would be really important to make sure that these are things that are, if I'm just thinking about doctors just now, but you could develop this in a very similar way for nurses, for healthcare professionals. I think it's really important that good training and education on asthma and allergies starts at medical school and is part of probably the curriculum of very many specializations after that. Certainly, it should be a major part in the curriculum if you develop towards being a general practitioner, but many other specialties, pediatrics, dermatology, respiratory medicine, in all of gastroenterology, they all come across people with allergies. And I think raising not just the awareness, but the actual knowledge and capability amongst colleagues, and especially for future colleagues, is, I think, absolutely vital.
Thank you very much, Professor. That leads very well to another question that we have received from Spain, Armando Ruiz, who is working with the Spanish Federation for Respiratory Diseases. And I think it could fit very well with what Tina was saying about FPA being in projects to improve patient participation. He's asking, how can patient organizations be really involved in digital projects from the beginning, not only on dissemination, and more specifically, how could real-world data be or become open source to be effective and promote innovative startups or innovative research?
Thank you. So I think there are two different aspects within this comment. One with regarding to the digital projects. I think one point really is where a lot of initiatives are also ongoing on the European level in a private-public partnership are like the hashtag Data Saves Lives by EPF, which also FPA is supporting, really try to raise awareness and to create trust in sharing healthcare data, of course, without the data privacy protection we need at this point. But this is really trying to really raise awareness to ensure trust in sharing data to enable further R&D, but also to, at the very end, increase efficiency of the several healthcare systems we do have at European level. On the other hand, the question regarding the real-world evidence or the real-world data, which are then collected, of course, they are for across the whole, let's say, patient journey, are relevant to take decisions. They can feed back properly in the R&D work, because there's the more, the better the treatment's getting for those people, for those patients who need it. But also, it's of course for subsequent decision-making processes and decisions which are coming along the way within the journey. So that's for sure important point, as now also the, let's say, the data capturing techniques and all the analysis techniques which are now rising and upcoming, just giving us really great opportunities to gather and learn more by the various data sources which are out there. And maybe then just one point also on the quality of life aspects. This is also one point which can feed into or feed by real-world evidence, especially, and as we have now a European HTA regulation, which is effective since the beginning of this year. This is also another regulation where we have the opportunity to bring together the regulators and the HTA bodies together with patients and manufacturers, really to discuss which kind of evidence do we really need in order to make the clinical trials relevant to patients in terms also of relevant endpoints. Thank you.
Thank you very much, Tina. I'd like to also address the same question to Stanimir, because you were also had a lot of expectations about digital health, artificial intelligence, and all these leading to precision medicine. So how can patient organizations be more involved also in the development of this legislation and its application?
First of all, I think pharmaceutical industry also needs to look more carefully when involving patients, also in these collaborative projects that we know each company already has with the IT industry. They're trying to develop new technologies, they're trying to bind the new technologies to the innovative medicine, and which is really innovative as a way to introduce new treatments on the market. But I think what's important right now is to involve also patients in this early stage when developing the technologies around the new medicines. What's more, I would like to see more and more companies to start implementing, even in the research and development phase, to incorporate different ways to capture real-life evidence for the patients, to prepare systems in place, if you want, questionnaires or other technologies that can capture the information from the patients once the medicine is on the market. I know the hesitation around that because it's very new. It's not something that is required by the regulators, but this is something that dramatically could improve patients' life, could improve adherence to treatment, could improve also the collaboration and the relation with the doctors and the healthcare centers, by providing a real live data so that they can properly address the issues which prevent the patient, for example, to stick to the therapy. But all this comes with a huge tag, which is the price tag, maybe in some cases, but also the knowledge that we need to generate and the know-how on how we provide these tools or these innovative approaches. This is also something to be further discussed. Patients need to be involved. They can only help to make the right decisions in every single stage, knowing what it is to live with this disease, which is their best expertise. And technologies make no difference in that. IT companies, but what's more, pharma and IT companies who are developing together now, they need to involve their patients early in the entire process. And it has great potential. We have seen it, and I'm sure that we will see more and more in future. Hopefully, we will see more and more co-developed with patients rather than what we have seen in the past, trying and mistakes, and then again trying and trying and trying until you ask your user, the patient who is going to use your technology, medicine, or whatever you're providing.
Thank you for that insight, Stanimir. I see questions coming, but I would like to take just one last one from Mr. Bernaclor, who is asking, could ensuring a healthy environment, for example, air quality, better air quality, contribute to improve allergy and asthma patients' quality of life and care? And I believe Professor Jürgen would like to respond to it.
The answer is yes, absolutely. This is a very important topic, and it's been recognized maybe over the last decade that air pollution contributes to allergy in two ways, really. On one hand, it contributes to setting up inflammation in our lungs, in our airways, but also on the skin. And if you've got an organ that has already inflammation, if you then have additional hits, if you're exposed to the allergen you're allergic to, you are likely to end up with much more severe responses, or an asthma if you are somebody who already is affected by poor air quality, and then you maybe catch a viral infection, you may end up with much more severe asthma attacks than people who are not affected by bad air quality. The other really interesting point is that many air pollutants will combine, for example, with pollens, with tree pollens, grass pollens, and make them much more allergenic. So make them much more able to induce allergic responses. So this has been an area of intense research, and this is one of the areas where the evidence is absolutely clear that air pollution contributes to making asthma and allergies worse.
Thank you, Professor. It's one of my duties to keep an eye on the time, and I see it's 2:11, so we should be moving forwards now. I thank you, all of you, for your participation in this event. I know there are questions that have been unanswered, but I would like to announce that we will be developing a report of this event, and we will try to address the answers the questions that remain into that report. I would like to invite now the vice chairs of the interest group on allergy and asthma, Mr. Olekas, to do the closing of this event. Mr. Olekas, the floor is yours.
Thank you, Isabel. Thank you very much. Dear colleagues, once again, I would like to express my delight at being a part of this event, which present us with an excellent opportunity to focus attention on the sector of health policy formation, which too often remain on the periphery of political debates. First and foremost, I would like to thank all the panelists and attendees for their contribution and involvement, as well as the interest group secretariat for arranging such a dynamic event. In addition, I'm delighted to be a co-host alongside my colleague Tilly Metz. However, as we heard during the lively debates, allergy and asthma are still quite prevalent and will continue to be so even after the COVID pandemic. Allergy and asthma continue to be critical to millions of people's quality of life, so we must act immediately. We, the Socialists and Democrats, as well as myself, are so supporters of the European Union strengthening involvement in the health. Looking forward to the European Health Union that prioritizes patients and their fundamental needs. We are looking forward to Health Union, which will not only be able to develop bridges between the countries and ensure that all European patients are treated equally, but will also provide an innovative perspectives to inclusive and modern healthcare. We should start by addressing how to define unmet needs in a way that is patient-centered, inclusive, improves patient access, and encourage research and innovation for new and better therapies patients with a chronic condition will benefit from an agreement on such definition. Second, there is a question how new technologies and digital tools may help ensure that everyone has access to the healthcare. To put it another way, it must be ensured that digital health does not cause additional disparities. Finally, there is the use of bridging research into line with reality. It only makes sense to encourage innovation in areas where there are unmet medical needs if research goals are aligned with the requirements of patients. A vision like this can be helped to create more individualized approach to the medicine, one that is tailored to certain patient subgroups or people. Meanwhile, by adapting research to the specific needs of patients, people with rare conditions like allergy and asthma will be able to see their lives improve as a result of improving therapies and care pathway. I would like to express my gratitude to all of the contribution who made this event possible, and send you all my best wishes for a happy and healthy new year. Thank you very much and good luck.
Thank you very much, Mr. Olekas, for your remarks. Thank everyone for the interest and participation in this event, which has been recorded and will be posted in our channels. For further information on the activities on the interest group, please visit the website allergyandasthmaparliament.org. And finally, this event has been possible thanks to unrestricted grants from EFA's sustainable funding partners, Chiesi, GSK, Sanofi, and Regeneron. Thank you for your support, for your attention, and I wish you a very nice afternoon.
Thank you to all. Bye-bye.
Thank you. Bye-bye.
Thank you. Take care all.